A neonate in cold stress faces an immediate physiological threat, a high surface area to volume ratio, and an inability to shiver. Compare that to an adult patient in the emergency room with severe salicylate toxicity, an aspirin overdose, exhibiting extreme tachypnea, diaphoresis, and systemic collapse. The neonate is successfully utilizing a life-saving physiological adaptation, while the adult is experiencing a lethal toxicological cascade. Despite these radically different etiologies, both patients are driven by the exact same cellular mechanism, mitochondrial uncoupling. This single mechanism yields identical macroscopic clinical signs in both patients: profound systemic hyperthermia and a severe high anion gap metabolic acidosis. To resolve this clinical paradox, we have to look past the bedside symptoms and examine the thermodynamic forces operating inside their cells. Understanding extreme physiological survival and toxicological death requires deconstructing cellular respiration and the strict stoichiometric limits of energy transfer. This diagram shows a cross-section of the inner mitochondrial membrane, the site of the electron transport chain. Reducing equivalents, specifically NADH and FADH2, donate electrons that travel sequentially down complexes 1 through 4. At the terminal step of this chain, oxygen acts as the final electron acceptor, combining with protons to form water. The energy derived from this electron transfer is used to actively pump hydrogen ions out of the matrix and into the intermembrane space. This accumulation of hydrogen ions creates a steep electrochemical gradient, defined as the proton motive force. Under normal conditions, the inner mitochondrial membrane is strictly impermeable to these protons. They can only re-enter the mitochondrial matrix through one highly specific channel, ATP synthase. As the protons flow mechanically through ATP synthase, they provide the necessary energy to phosphorylate ADP into ATP. This defines the concept of coupling. Cellular oxygen consumption is entirely dictated by the demand for ATP synthesis. Normal aerobic metabolism is a perfectly coupled system, where thermodynamic potential energy is efficiently captured as usable chemical energy. This system breaks when an uncoupling agent inserts itself into the inner mitochondrial membrane, creating a new channel. This new pathway allows hydrogen ions to leak back into the mitochondrial matrix, bypassing ATP synthase entirely. As a direct result, the proton motive force rapidly dissipates. Because ATP synthase is bypassed, the phosphorylation of ADP ceases. ATP production via this pathway halts. The potential energy of the proton gradient is not destroyed. Instead, it is released entirely as pure heat. Uncoupling severs the stoichiometric link. The cell sacrifices the generation of chemical energy, turning its mitochondria into unregulated thermodynamic furnaces. This graph plots the immediate cellular fallout. As the uncoupling leak persists, cellular ATP levels drop sharply. Detecting the energy deficit, the electron transport chain shifts into overdrive in a futile attempt to restore the lost proton gradient. This overdrive results in a massive, uninhibited spike in total oxygen consumption. To supply more NADH for this overdrive, the TCA cycle accelerates proportionally, leading to a massive spike in carbon dioxide production. Because aerobic ATP synthesis has failed, the cell experiences a secondary crisis. It is forced to shift entirely to anaerobic glycolysis to generate energy. Glycogen stores are rapidly depleted, resulting in the massive generation of lactic acid. The uncoupled cell is trapped, maximizing oxygen intake and acid output, while starving for usable energy. Returning to the neonate. Their high surface area to volume ratio and lack of mechanical shivering require an alternative to survive cold stress. The drop in ambient temperature activates the sympathetic nervous system, specifically targeting beta-3 adrenergic receptors. These receptors are anatomically targeted to brown adipose tissue, a specialized fat reserve densely packed with mitochondria. Mitochondria in this tissue utilize a physiological uncoupling protein called UCP1, or thermogenin, shown here at its primary locations in the interscapular and perinephric regions. UCP1 acts as the exact structural bypass we modeled earlier, deliberately leaking protons across the membrane to generate heat. This local heat production is transferred directly to the highly vascularized surrounding tissue, warming the blood and maintaining the neonate's core temperature. In brown adipose tissue, uncoupling is a precisely regulated neuroendocrine adaptation vital for thermal survival. In the adult emergency presentation, massive doses of salicylates act as exogenous chemical uncoupling agents. Instead of being localized to specific tissue, salicylate uncoupling is systemic and unregulated, driving life-threatening hyperthermia. The hypermetabolic cascade drives a massive spike in carbon dioxide production, which directly stimulates the medullary respiratory centers in the brain. This central stimulation forces severe tachypnea. The patient blues off excess CO2, initially presenting with a respiratory alkalosis. This flowchart tracks the diverging pathology. While the CO2 spike drives the respiratory alkalosis, the cellular shift to anaerobic glycolysis causes a massive accumulation of lactic acid and ketoacids. These two forces create the classic complex mixed acid-base disorder that is pathognomonic of aspirin poisoning. When an uncoupling agent overrides physiological regulation, the resulting hypermetabolism overwhelms the body's compensatory mechanisms, driving fatal acid-base and thermal collapse. Normal cellular respiration operates on a strict stoichiometric dependency between oxygen consumption and ATP generation. Uncoupling bypasses this dependency entirely, converting an electrochemical gradient directly into heat at the expense of chemical energy. In neonates, the receptor-mediated activation of UCP1 harnesses this heat to save a freezing infant. In salicylate toxicity, it destroys the host's regulatory systems from the inside out. Macroscopic vital signs, the tachypnea, the hyperthermia, and the acidosis, are direct, measurable readouts of microscopic mitochondrial failure. Whether triggered by the autonomic nervous system or by a toxic overdose, uncoupled respiration forces the body into its most extreme hypermetabolic state, proving that life and death hinge on the efficiency of a single microscopic membrane.